looking at the adductors. So adductors is this big mass of muscle that you can kind of grab onto right here in the medial thigh. So the importance of these guys is it's the meeting ground for the other large musculature of our legs. So our quads come in and they hook into the femur bone on the front of the leg, and then in the back of the leg, the hamstrings come and they tie into the middle part of the femur here. And the adductors are all the tissue that supplies that area between those two larger groups of muscles. So the importance of the adductors is that it plays such a big role in knee mechanics. It plays a role in hip mechanics and hip mobility, as well as a huge role in stability within our pelvis. So it's a huge contributor to oftentimes sciatic pain, SI joint pain. It can play a big role in a lot of other dysfunction that we might feel within our bodies. So we're going to look at mobilizing in the adductors today. So something small like a lacrosse ball is fine. If you have a little bit larger of a mass, you might look at finding a little bit larger of a ball. Either way is fine. Whatever you have can work. But we're looking at taking the ball and finding our sits bone. So kind of that bony place of our pelvis that we find that we sit through. So we're going to take the ball and snug it right in the middle part of that bone and kind of squish it down against whatever you're sitting on, whether it be a chair. It's nice to have a little bit of freedom to move your hip on whatever you choose to sit on. So we're going to snug it right in the inner side or the medial side of that bone and work one side at a time. So we're looking at, you can kind of give yourself a little bit of support if it's too intense, but you can lift yourself off of the surface and give yourself a little bit of room to move. But what we're looking at doing is not getting sucked into the hamstring mass, because those things are different. Working the connection and the fibers between where the two meet is perfectly fine and oftentimes a really great mobility tool. But we're looking at staying in this muscular mass here in the middle. And you can spend a minute or so just exploring around this tissue, coming in toward groin line, and then just right around that sits bone. And then you can start moving the leg a bit. So taking yourself into a little bit more internal rotation and shifting the weight will allow you to access the middle part of this a little bit more easily. And we're remembering to breathe. We're not holding our breath. If it's so intense that you can't possibly think about taking a breath in, then lift some weight off and don't go quite as deep for these first few times. You might just have to downregulate the system a little bit. Keep in mind that there are some nerves in here, so if you're zinging something or creating any sort of numbness or tingling down the leg, that you don't want to stay on that area specifically. And you're going to work to spend about 2 to 3 minutes in this area. You can rotate the leg in and find a little bit different of a spot, but most of the access is going to be coming into this internal rotation position and working through the belly of that muscle. It won't be the most pleasant thing you've done today, but it's a very viable and essential part of pelvic, hip, and leg movement. So oftentimes when the adductors are tight, we're going to find that the length taken, and if it's shortened, and especially in a standing or squat position, that if this is shortened, that we're going to find that the knee pulls inward. And then the IT band can then get stretched and cause hip pain or IT band pain. So oftentimes the biggest sufferers are weightlifters, just from lack of addressing it, but also running and cyclists tend to have a lot of tightness in these adductors. So the next big internal rotator that's often neglected that we're going to look at is the TFL. So TFL is the muscular piece of the IT band, or the top muscle belly of the IT band. So most of us have heard of some sort of IT band dysfunction or pain down this lateral leg, or maybe a little bit of knee pain at the attachment side of IT band. The TFL is the muscle belly that begins that fascial band. So we're looking at finding the hip bone or the bony part of your pelvis here. And the TFL starts right around this area and wraps to right about where the bony part of the back side of your pelvis starts too. So this is the area that we're looking at mobilizing with this one. So again, a larger ball or a lacrosse ball, either one is fine. And we're looking at coming onto the side and putting the ball right into that meaty area. And you're gonna bring yourself down. If a lacrosse ball just feels terrible, like there's no way you can bear this, you can also try a tennis ball as well. So what we're gonna look at doing is coming around to right about where the crease of the hip starts, or where the ball kind of meets that bone. And starting there just gives you a good point that you can rotate until you feel like that ball might slip out, spending at least 30 to 40 seconds right on this initial point. And then you can begin to slide yourself forward on the ball so that the ball is coming a little bit further back into that muscle belly. And at that point, you want to bring the leg out a little bit straighter so you have a little bit longer of a lever to work from. But the goal is much the same. So we're going to take the top leg and just rotate in and out to create the movement and mobility around on that muscle belly. Spending at least 30 seconds in this area. And then walk yourself up a little bit and hit the top portion of it. When you get here, you might feel like you can contract and squeeze your tush, or squeezing the glute to draw that muscle back, and do a little bit of contract, relax. And with the contract, relax, we're using our breath. So you're making sure that you're breathing into the diaphragm and relaxing so that your system understands that you're safe in this area, that you're meaning to do this, and so that the mobility work that you put in is a long-lasting effect rather than tightening right back up. And then slide up. So now we're just at the base of the TFL where it meets the IT band, and we're working through that area. Again, a little bit of rotation, and the top hip just changes the angle of to where that ball is making a connection with the tissues, and where the connection where they're meeting one another changes as well. You can do a little bit more contract, relax here, so squeezing the bottom side glute, and then relax and let that tissue melt around the ball. And breathe, and give it another good contract. Tighten up everything, and then let it relax and melt around the ball, and a big belly breath there. Spending at least 2 minutes, 3 if you can tolerate, to really get the full benefit of this tissue mode.